Welcome to all. My name is Lauren Vogue. I am currently the lead curator for the Duchenne Registry here at PPMD. Thank you so much for joining our PPMD webinar today, Discover the Power of Your Data. This webinar is focused on PPMD's The Duchenne Registry and the impact of your data in advancing research and healthcare in the Duchenne and Becker community. When we say your data, today's session is most intended for current or potential participants of the Duchenne Registry. Any person with Duchenne, Becker, or who carries a DMD variant is invited to participate in this registry, and we're glad that you're listening today. Our goals today are for everyone to leave with a stronger understanding of why their data matters and to be empowered that they can help shape the future with their data. To reach our goals today, we're excited to be able to present a historical context for the registry, a current participant perspective, highlights of our current registry statistics, and a concrete example about the impact of your registry data this year in 2025. And we'll close with an opportunity for questions, which can be submitted within the webinar view with the chat. Next slide. Before introducing our first speakers, Anne Martin and Pat Furlong, it may be helpful to spend just a moment orienting ourselves to the Duchenne Registry. So if someone were to ask you what the Duchenne Registry is and what it does, what would you say? So I think of the Duchenne Registry that we can describe it in this framework. The registry is a research study designed to collect information about a person's health over many years, even decades. This information is reported directly by people with Duchenne, Becker, who are carriers, or of course by their parent or guardian. And this means that you have the power on your own to participate in this research and contribute meaningful data directly from your phone, tablet, anywhere you are in the world. And that database of information, which grows over time, can be used for many purposes in a de-identified manner. So researchers and industry partners who receive approval to use registry data can use this to answer research questions or plan other studies or trials. In the other direction, researchers can also request that we as PPMD reach back to participants about potential research opportunities. PPMD registry staff also may act as researchers themselves. And as more people join the registry and enter their data over time, building that long-term story, the power of the registry grows. Next slide. Although we don't all know each other personally, there are a lot of people who make the registry function so that it can benefit research. So you are the number one contributor to the research. Behind the scenes, supporting your data is a staff of 4 PPMD team members who support the registry directly. And that includes myself and my teammates Anne, Catherine, and Kayla, who will speak shortly. We are the people you interact with when you need help with your account, the people who email you reminders. We work on data quality, long-term plans and improvements for the registry, and we are also researchers of the data. Your data, of course, is also supported by technical infrastructure, both for the app interface that a person uses, as well as for the database where all the information is stored. Both of those have technical support teams, and they help make sure that the data is usable and, of course, is secure. The Duchenne Registry is also supported by a steering committee comprised of a combination of additional PPMD staff, researchers, clinicians, and registry participants. This group guides and provides feedback on the future plans for the registry to ensure that many perspectives are always considered when we're thinking about registry data use or future enhancement. So when you contribute data, we want you to know that there is a dedicated team of people making sure that it can have the impact you intended. So, that's a big staff of people working on it now, but the history and the vision of the registry starts with our founder, Pat Furlong. And so I'm now pleased to introduce Anne Martin, who is our Vice President of Community Research and Genetic Services and lead over all registry efforts, serving the registry for the last 15 years. And Anne will lead our discussion with Pat Furlong about how and why the registry came to exist.
Great. Thank you so much, Lauren. Yeah, so as Lauren said, I've been with PPMD for many years and have always worked closely with the Duchenne Registry and have also had the pleasure of working with Pat Furlong, who I know probably needs no introduction, but Pat is PPMD's founder and CEO. So welcome, Pat, and thank you for joining us today.
Thank you, Anne. It's really a pleasure to be here. The registry is very close to my heart.
Yes. So, for those who don't know, the registry actually began about 18 years ago. It was back in 2007. So, Pat, I'm curious just from your perspective, like where the idea came from to start the registry and what motivated you to create the registry.
Yeah, thank you, Anne. That's a good question. When my boys were diagnosed with Duchenne, I asked for the data. What do we know about them? Can we predict, what's going to happen when? I asked questions about their heart. Is the heart a muscle too? It was sort of dismissed at the time. And so, ask about, do we use medical tools? What are we familiar with here? And no one could answer that question. As we started PPMD and as the MD Care Act came to fruition and was signed into law in 2001, I was really looking at who collects data and how do they collect it and what has happened based on it. And I looked to this Cystic Fibrosis Foundation. And so Cystic Fibrosis each year would publish data from their clinics, which was quite incredible. It was data about that each patient, obviously, but it was this collective data about what kind of infections those patients had, what antibiotics they were treated with, if that had to be repeated. But it didn't stop there. It also went into the fact how they did in everyday life. Were they in school? Did they go to college? Were they employed? I used to laugh in my mind and think, well, I bet they even know what size dress or underwear they wear, which was probably inaccurate and inappropriate to ask. But it was such a complete data that when the CDC began their MD StarNet to look at surveillance, they were looking at who has this diagnosis and how many people have this diagnosis. I had a meeting with the CDC and I took the CF annual registry report with me and said, I want this. And I remember them laughing at me and saying, well, you're not CF. I said, no, but I really want to know about when the age of diagnosis, the genetics of these young boys and some women who are diagnosed. I want to understand what interventions they use and if those are successful or not. And I want to be able to improve that so that we know the things that we're doing have benefit for these patients. So that led to a discussion, and I think people that know me know I've gotten a lot of no's. And I said to the CDC, would you do this registry? And they said, no, you do it. So that's when we teamed up with Emory Genetics and we began thinking through. I met Kyle Brown at that point, who had a platform week that he was innovating and said, let's use that platform, let's use Emory Genetics, and let's begin. And that's how the registry came to fruition with a grant from the Center for Disease Control.
It's amazing. It's always great to hear that history, and we're so thankful you had that foresight and vision for this. I am curious, since we're talking about back in the early 2000s, just kind of what the landscape for Duchenne was like. I realize we're very fortunate now to have so many industries working in the Duchenne space, but I imagine it wasn't always like that. So I'm just curious, like, were there industries interested in Duchenne at that time?
There were no industry, excuse me, when the Care Act was passed, there was no industry interest. Later on, and I think about 2014, PTC Therapeutics was the first company to enter our space. And they entered our space with begging because we went to them and they were looking at nonsense suppression. And we said, please start here. But that was later. I think what we can say with the MD Care Act and its accumulated investment, they've supported all the basic research, and every single therapy that's in development today has been supported by either the NIH or the Department of Defense or the Center for Disease Control, although they're mostly interested in surveillance. So back then there were no industry, but I knew that unless we had data, we couldn't attract industry, right? Because if industry was to say, I would like to do a study and look at, I don't know, boys from the age of 12 to 15 or females who are carriers. We didn't have the data to say who those people were in terms of where they might have lived or that in fact they existed at all. So this was, in my view, a way to understand the community where the patients were diagnosed so that we can even now today say, there's a great population in this state or that state, not specific patients, but to be able to give the genetics of people, to be able to say, these patients have this particular genetics. And I think that way back then, just to think through, how are you going to tell the story about what you know about this disease and people who are diagnosed, and how are you going to gain interest without that data? So that was a time when there was nothing there, but it's also on the care side. And, I think we were asking the question, is the heart a muscle too? And it obviously is. Could we start prevention of heart disease? And how do we do that? So we're thinking like, if you start an ACE inhibitor or an ARB or other cardiac medicines at 8 years old, how are you going to know that that's even useful unless you're collecting that data? So it worked on both sides to be able to tell the story to industry that, hey, we know a lot about our community, we know about these patients, and to also tell the clinicians, let's try these things to see if we can prevent some of the natural history of the heart or the loss of function.
Thank you for that. Well, speaking of collecting the data, I think your vision initially for the registry was that it would be patient reported, which I think at the time and even now is not necessarily the norm. Most registries are clinician reported. So I'm curious why you had the vision to make this registry patient reported.
So it's kind of a crazy story, as many stories are. When my boys were diagnosed, I went to the Cincinnati Children's, and there was a neurologist there that preceded Brenda Wong. I'm certainly not as well versed or passionate as Brenda Wong would be in the future that happened. But so this particular physician said to me that he was working on a drug that he might be able to think about in bringing to the clinic. And so in my anxiety of let's do that yesterday, he said to me, well, we'll check in with you every 6 months and we'll see how things are going. And I turned to him and said, you can check in with me every single day because I will know how things are going every single day. So the reason for a patient reported registry is because I think we as patients or as parents of individuals with a diagnosis or as female carriers of this variant, I think we want to record how things are going so that if you would have said to me, as a clinician, when did Patrick and Chris stop walking? They would say at the ages of 8 and 9, right? I would tell you on June the 3rd, Chris stopped walking of that year, so many years back. I knew the exact date and the exact time that they stopped walking. I knew that I was standing in a room with Patrick and he said, my legs don't work anymore. And he stopped walking and I could record that. So I think patient recorded data is so critically important to understand, first of all, the view of the individual that has the diagnosis or the family, but also on a day-to-day basis so that we can pinpoint when things are happening and have much more detailed data, in my view, to combine with the clinical data, which I think is a robust, holistic picture of how this individual is doing with the diagnosis.
Great. Well, I agree. I think patients are the most reliable source of data. So I'm glad you had that vision. So what is your vision for the registry, kind of looking to the future? What are you hoping we can achieve?
First of all, I am immensely grateful to the team we have because I think the way that you really make sure that the data is curated and accurate and able to be integrated is amazing. So I think we're going to learn a lot. We now have 8 approvals and potentially another approval in August. We are looking at a natural history that is evolving over time. My boys were off their feet at 8 and 9. Now young men are walking much later. We know much more about female carriers because when I too am a carrier of carry the variant, and it was you're just fine. But we know that some of these females are not just fine. So my vision of this is to really holistically understand this community and how it's evolving, to understand how new therapies are applied and the benefit and risk that they carry with them, and hopefully more benefit than risk, and to look toward a future as we do newborn screening, to be able to look across age and stage, to get a baby when they're born, to make sure that adults, people who carry the variant, people who have Becker, understand that natural history and can apply therapies appropriately so that they're safe and effective, and we can change the natural history completely of this disease. So my vision is that we'll know more, we'll be able to do more, and we'll have very successful outcomes in terms of improving the quality of life and the lifespan.
It sounds wonderful. And for the families who are listening today or listen to this after the fact as a recording, like, and what is the why behind participating in the registry? Like, what would be your call to action to these families as to why it's so important to participate?
I think families have so much on their plate. Sometimes entering registry data seems like the last thing on the list. And for me, I think it should be a priority, because I think collective knowledge is the most important knowledge, right? So that we can understand how a certain steroid regimen works, how one of the new therapies work, how gene therapy and the durability of gene therapy. So I think this is a chance for you to be a citizen scientist and learn collectively and personally about how things are going. I'm hopeful it'll help decision making in the future. I'm hopeful it'll help really benefit this community in terms of getting and seeking more approvals, more companies coming into the space. So it is always sort of last on your list to, oh, do I have to go to data? Do I have to put in data? But I think if you all have made it easy, relatively easy to answer the questions. And I think for us together as a community to be able to learn from the questions we're asking, but also to hear from you, what are we missing? Send us a question that you think, I'm curious about this, so that we can collectively learn as our world evolves and as these new therapies are applied. We can learn together so that we do the very best for the people with a diagnosis.
Thank you, Pat. That's so well said. We're so grateful for you and for all of your incredible vision and leadership over the years. So thank you. And thank you for joining us today. I know you're busy at another conference, so we really appreciate you taking the time out.
Well, I mean, you're all just magic, and the way you speak to parents and explain this very complex gene, right, and its variants, and try to help us understand in such a way that we can look personally as well as collectively is really remarkable. So I appreciate it. And delicate subjects, having been in one of those gene therapy discussions, they're hard. They're hard to look at your family and have to say to a daughter or a mom or a grandmother that you're a carrier. I think all of those, you've really helped those discussions, made them, I won't say easy, but made them soft enough that we can talk openly. So I thank you for that.
Thank you. All right. Well, next, I think we'll move to Lauren. Lauren is actually going to be speaking with one of our steering committee members.
Thank you so much, Anne. And it was just, it is always so impactful to hear the full history and the full story of how we arrived here. And so I'm so pleased to get to interview Jen Schwartz on this call about her experience with the registry. Jen is a member of our Duchenne Registry Steering Committee, is a participant, a Connect Group coordinator for her local area, and of course, a parent to her son, Ben, who is living with Duchenne. So thank you so much, Jen, for joining us today.
Yeah, absolutely.
So, I mean, of course, they have some like registry specific questions, but I hope you'd be willing to share with us just a little bit about Ben and your, family story that brought you to PPMD in the first place.
Yeah, absolutely. So my son, Ben, is a 12-year-old who has Duchenne. He was diagnosed when he was about 3.5. We have 3 children. I have a 16-year-old daughter. I have Ben, who's 12, and then I have a 9-year-old son. So when we had our youngest, I started to realize that Ben wasn't as strong as my daughter was at 3 years old. So that prompted us to go down this path of researching what was going on. And we came back with a Duchenne diagnosis. Ben Ben's like many other middle school boys. He loves Legos. He loves sports. He helps manage his baseball and basketball teams at school, and he is the best cheerleader for his older sister and younger brother. So
That's wonderful. I always like picturing all the activities that they're getting up to. It sounds like in his school and with your family. So I'm curious. You had that diagnosis for Ben. At what point did you encounter the registry and join the registry? What was that experience like?
yeah, it was probably within the first 3 months or so of diagnosis. At diagnosis, our Duchenne Care Center had introduced us to PPMD. And so we had, a big stack of folders and paperwork that we would slowly make our way through. And I remember the first night that I started going through the registry. My husband and I, when our son was diagnosed, decided that we wanted to be involved in things that we could to help shape the course of Duchenne. And we really hope that that's for Ben. But if it's not for Ben, then we hope it's for the boys behind him. We're thankful for the people who contributed ahead of us to get us to the point that we have medications and options. And so we hope that this impacts our current generation. And if not, we have confidence it will behind us. Um, the first night that I sat down to do the registry, I opened it up and I started looking at the first few questions. And there were some questions that I hadn't really projected what that meant for Ben at 3 years old. I remember one around brushing your teeth, like what's your ability to brush your teeth? And so that night I closed the registry and I said, good evening, I'm out. Just it was a lot for me to process at once. But I kept that file on my desk, and eventually when I was in a good spot, I came back and was ready to start answering those questions. Um, so I started to move through those questions. I do appreciate that I have both the app and I do it on my computer. But there's some times where I'm sitting waiting for kids' events that I'll go in and be like, oh yeah, I have a cardiac segment I need to go in and do. Or if we're coming out of a doctor's appointment and I know that I have some pending information, I might go put that in right away. So I do really just break it up into segments when it's convenient. And there's also times that I don't know everything. So there's some pieces of data that I'm like, yeah, I don't have that. But if I get you 95% of the data on Ben, I think that's more helpful than not having any. So I try and share everything I can.
Yeah, that's amazing, kind of thinking through your approach. And one thing I want to just um, affirm you on is I want to appreciate, I think we as researchers usually do and have thoughtfully considered, the time burden and how we process those things. And I just want to acknowledge that there's also an emotional ask that we want to acknowledge is real, and that we appreciate you kind of naming that, but also kind of saying like, what was the practical way you were able to deal with that? And be like, that's okay to not do that right now, right? That's okay we're going to set that aside and come back to it later. And I think you were also kind of thinking through some of the ways you fit this in. I mean, um, you hopefully okay to share and brag on you. You've completed this data set in our registry many times over, and that is the goal, right? Of course, we love the snapshots at single points in time, but that's how we build this whole story. But of course, as especially the goal is that we have many, many, many more years of time. That means there's many years of, doing data. How do you stay motivated to that? It sounds like you have some ways you kind of fit that in.
Yeah. Um, I think there's two things. I think the first thing is when Ben was diagnosed, we decided we wanted to try and do everything we can. And while this one is easy to ignore, it also is one that's really easy to do. So some people travel a lot for medical trials. Some people contribute in different ways, but I think this one is something that you can fit into your schedule at any point in time. It's just trying to remember and get out there and do it. So one of our motivations is just helping to provide information. And we've talked with Ben a lot about this. When we we've talked about him opting into other things that are ways to contribute. So we talk with him about, would this be something you're interested in? Would you want to provide more information? And sometimes he's sitting with me and I'll ask him some questions like, hey, what about this? Do you think this is better or worse or more or less? The other thing that you mentioned, Lauren, is now that I'm sitting on the steering committee, I get to see the back end of how much time and energy you guys really do spend on making it easy for parents. So I know that we've sat in conversations and I'm like, that's too complicated. I couldn't answer that. Or thinking about just what makes it really easy. Like you can finish a segment and come back. And so often I'll finish a couple of segments when I have time and leave and come back in again. So I think our main motivation is really just being able to help with providing data. And sometimes we talk about with Ben that he's a rare situation where he has great information that other people would love to have some insights too. So if it's easy and we can do it, let's do it the best we can. And then there are some times where I know I have gotten a message maybe 6 months later and I'm like, oh man, I know I'm kind of delinquent on reporting. And it's easy to like fall off. It's kind of like when you're trying to eat healthy and then you have, a great night of pizza. Doesn't mean that it's totally wasted. The next day you can still go back and, have eggs for breakfast. So there's some times where I wane a little bit, but then I get a reminder or something pops up or I hear about it at a PPMD event that I'm like, you know what, I do need to get back in there and do a little bit more.
I really appreciate that approach you have. I think one of the things you and I have talked about and that we want to put forward is this idea of, um, especially over this long period of time, that things do not need to be perfect. I think to the analogy you used. And so I appreciate you really sharing that mindset of we do what we can, and I think some is better than none. We really appreciate that perspective. Um, are there any last thoughts about kind of experiences you've taken away or value you found, or even just like the call you'd put out to other people?
Yeah. One thing that has been an unintended benefit for me is it helps me to prepare for our Duchenne journey when I know things about the future. So I gave that example about how independent somebody could be brushing their teeth. That's something that I didn't think of early on in our journey. And so just being able to understand like what things might come up in the future has been helpful for me. And then to even do a little bit of an assessment. Sometimes when I go through the registry, I think, you know what, that maybe did change. And I probably should talk to my doctor about that next time that we're in. So I wouldn't have had that reflection time if I didn't complete the registry. But I just think there's a lot of power in numbers. So the more people that can report data, and hopefully just take a few minutes of time when you're waiting for something or watching a TV show at night to flip through a couple of the questions, it really does provide a big impact in the research community.
Yeah, I'm so glad to hear that perspective, and I'm so glad you have contributed, and I think it's really meaningful for others to hear that. I think one of the goals of both this webinar and things that we're working on are to build these personal relationships that when you put data in a box, it is not a black box that goes nowhere, and that there's this community here that we're working towards something together. And I really appreciate you being a face for that with us today, and for giving your time and your energy to the effort. So thank you so much, Jen.
Absolutely.
And I think as we, work to make things uh, personal, and before kind of finishing out this community perspective section, we want to hear your perspectives in your community. So to our host, I have got a couple quotes just to share about other people's perspectives. So from Kevin, a Duchenne parent, I am a strong advocate for the Duchenne Registry as it plays a crucial role in facilitating further research, which will benefit not only my son James, but also the entire Duchenne community. The decision to join the Duchenne Registry was motivated by a desire to contribute to the advancement of research, even if we're not actively participating in a study. And I appreciate that balance between being involved in the research that's possible at a given time, even if there's time points where other research opportunities maybe just aren't happening for that current individual. And from another parents, Ashlyn and Chris, I think this strongly, almost amazingly verbatim echoes something that Pat said, which is the more information provided, the more information or the more knowledge gained. The more knowledge gained, the more opportunity there is for long, fulfilling lives for our loved ones living with DMD. So again, whatever your why for participating, when you participate, we really want you to feel like you're a part of a community, and we hope that we make that feel real to you in your participation. So next, I'm going to turn it over to my teammate Kayla Banks to review current registry participation. Kayla is a PPMD manager of community research and genetic services and the manager of the Decode Duchenne sponsored testing program.
Thank you, Lauren. So I would like to take some time to reflect on the current state of the registry and the impact of each participant's data. And you've heard it multiple times already today, but I will restate that the more data that is shared within the registry, the more powerful that data becomes. And to date, the registry contains over 83,000 different surveys that were completed and over 2,500 genetic testing reports from 6,200 participants. Data from the registry can be used to answer important questions regarding dystrophinopathy, and it's vitally important that we have large, comprehensive data sets to be able to come to conclusions and to understand patterns. And additionally, broader participation allows for us not only to understand those general trends within the community, but we can start to better understand the unique experiences and potentially the aspects of the spectrum of symptoms that weren't previously well understood. And to give an example of this, we can look at a large group of participants who all have the same genetic variant, and that could potentially help us to understand what specific diagnosis is most commonly associated with a particular genetic variant. But if we look more closely at the individual level, we could also begin to understand what factors may lead to a single person to have a different experience than others who are in their similar age group or with the same genetic variant. Research completed using data from the registry allows for both academia and industry to better understand who exists within the spectrum of dystrophinopathy, and they can utilize that information to shape how they design studies and recruit for studies. An example of this would be if an industry sponsor is trying to understand what types of genetic variants could be a target for a variant-specific therapy, they may want to utilize de-identified data so that they can better understand the number of individuals, and they're specifically looking at the number of participants, but to kind of generalize that to the number of individuals who may be able to utilize a specific therapeutic approach. And in some cases, that data utilization from the registry may lead to an individual within the registry being connected back to research that they may be eligible to participate in. That was a quick review of some of the current state of the registry, but let's hand it over to Catherine Anderson, who is the Community Research Manager of Data Initiatives and Advocacy, and she is going to discuss a recent example of how data from the Duchenne Registry was used.
Thanks so much, Kayla. So yeah, I'm Catherine Anderson. I'm the genetic counselor on our team who is primarily working on our federal and state newborn screening initiatives. So I'll share a little bit about how data in the registry has been and also will be vital to proving that early diagnosis improves outcomes in Duchenne. Next, please. As a bit of background, one of our federal advocacy efforts is focused on getting Duchenne onto the Recommended Uniform Screening Panel, or RUSP. The RUSP is the federal recommendation for which conditions all babies should be screened for when they're born. Although the nomination was submitted in the summer of 2022, the work to reach nomination started over 10 years ago through the collaboration of dozens of clinicians, patient advocates, researchers, industry partners, and federal partners. Next, please. After the nomination, it took about a year for Duchenne to move to evidence review, which is a process where a work group evaluates all the evidence about the benefit of newborn screening for a condition to present to the federal committee. The federal committee then makes the recommendations. In May of last year, the committee decided to hold off on voting regarding Duchenne until May of 2025. They shared that in order to vote, they needed more evidence to answer a very specific question. Does starting treatment prior to the average age of diagnosis improve healthcare outcomes for people with Duchenne? Next. To help address the committee's questions, we hosted the Duchenne Early Intervention Symposium. The QR code there in the corner goes to the summary and recording of this event if you'd like to watch it later. Between May of 2024 and March of 2025, we asked researchers and clinicians to send in projects that focused on comparing outcomes between children who were treated prior to the average age of diagnosis, which is between 4 and 5, and those who were treated later. We also dove into the registry to see how the data you shared could contribute to this research. Next. A major priority to the committee was to learn about the health outcomes of siblings that were treated at different ages. The logic of focusing on siblings is that siblings tend to share the same environment and DMD variant. Although we know there can be differences in how siblings present, we would expect them to have a more similar trajectory than two random people with Duchenne. And if the only major difference for a pair of siblings is when their treatment started, we can look at outcomes like how long they were walking to understand the impact of that difference in treatment on their life. Next. Because we had a strong community of participants in the registry, we already had the data we needed to find siblings and understand some of their clinical outcomes. We found siblings by searching for 2 or more males within 10 years of age that shared the same variant, last name, and city. We also wanted to make sure we weren't finding twins because they're likely to get diagnosed and treated around the same time. And then we homed in on questions registrants answered about when they started steroid treatment and at what age they lost ambulation. Next. At the time of this project, there were 6,096 participants in the registry, and after filtering to individuals who appeared to be siblings, we found 150 people, 69 pairs of siblings, and 4 trios. It could be that there are more people in the registry who have affected siblings, but those siblings are either not in the registry or they didn't meet the criteria we set to find them. Narrowing to sibling groups that included 2 males who weren't twins, we were left with 59 pairs of siblings, which was a really great starting point. But unfortunately, as we dug into the data further, we realized that we had limited information about a lot of the siblings. For 6 sets of siblings, we didn't have the data to know when they started steroids. For 17 sets, we didn't know when they lost ambulation. And for 32 of the pairs, we didn't have either piece of information. For some of these, it could be that they had never taken steroids or hadn't lost ambulation, but looking closer, it appeared that most of them probably weren't updated as their care changed. Removing those who didn't have the data we needed, we were left with only 4 pairs of siblings. And unfortunately, among those 4, there wasn't a single set that included a sibling who was diagnosed and treated younger than age 5. So we weren't able to explore the question of early treatment in that way, but we decided to see if we could get at the same answer in another way. Next slide. We didn't have enough data points to focus on people who share the same environment and genetic variant, but we did have the opportunity to answer this question with a focus on people who just have similar variants. Many of you have not only answered a ton of surveys, but also dug up your or your relatives' genetic test results to send to our team. We review those and confirm your variant so that it can be used to answer clinical and research questions like this. Now, instead of looking at siblings, we looked at all the data we have in the registry for anyone who started steroids treatment earlier versus later, with a focus on genetic variants. So we were looking for a lot of the same survey responses, but instead of narrowing to siblings to try to control for some of the variation between people, a subset of our analysis focused on people who have a handful of genetic variants that are known to be very specific to a classic Duchenne progression. Next. The group of participants that we were looking at this time did also have some data limitations, since they had to meet a defined definition of Duchenne and also have all the data points we were looking for, including taking the time to upload their test report. However, we had ended up with a much bigger group of people to work with than when trying to find siblings with all those same data points. So first, we broke the registrants into groups based on when they started steroids. Since the average age of diagnosis of Duchenne is between 4 and 5, we divided the registrants into groups that started steroids younger than 4, younger than 5, or 5 and older. We also made sure there weren't any big environmental differences between these groups, like a difference in using variant-specific therapies. Next. When we defined our Duchenne-specific variants, We did it this way. We narrowed our focus to out-of-frame exon deletions. And in the registry and in major publications, the deletions that are listed as group A present with this very classic Duchenne picture. And then the registry team also did a deep dive into the literature and looked at each variant. It was reviewed by 2 genetic counselors independently to look for one-off cases where the variants might present differently. And of the 9 variants in group A, there were 3 variants that appeared to very strictly follow a Duchenne picture: deletion of exons 44, 45 through 50, and 45 through 52. These variants we listed as group B. Next, please. First, we wanted to compare the group that started steroids younger than age 4 with those that started 5 and older. We could see from the data that those who started steroids earlier lost ambulation later. They walked until around age 12 instead of around age 11 for those that started 5 and older. However, when you run a statistical analysis, you also need to confirm that that difference is statistically significant. When researchers say a result is statistically significant, they mean they found a real difference, not one that could have just happened by luck. So statistical significance means there's strong enough evidence to believe the result reflects something true about the bigger picture, not just a coincidence in the data that we looked at. In many research studies, you'll see the significance of the data portrayed by a p-value. If the p-value is smaller than 0.05, the result is statistically significant. For this first analysis of the group younger than 4 versus 5 and older, the p-value was 0.215, larger than 0.05. Even though there was about a 1-year difference in loss of ambulation, the data wasn't strong enough to confirm that this wasn't a coincidence. This isn't uncommon to see when one of your comparison groups is very small. Unfortunately, we only had 23 registrants who started steroids younger than age 4 and had all the data points we needed. Based on the analysis, we couldn't know for sure if those 23 accurately represent the larger population of people who start steroids that young. Next. So then we looked at our larger group of registrants who started steroids early, so including that year in between that started between 4 and 5. We still saw that difference in walking of about 1 year, but because our comparison groups were larger, we could confidently say that this difference was not luck. Our p-value is 0.027. Next. Then we dug into our group A deletions and group B deletions. Because this is another subdivision of the data, we knew that our groups would be smaller and we need to focus on those treated younger than 5 versus older than 5 to maximize our group sizes. Next, please. Even so, we only had 4 people who started steroids younger than age 5 and also had a group B deletion. What we found, though, is that even though these groups are tremendously small, the differences were so strong that we were still able to reach statistical significance. Among our group A deletions, people who started steroids younger than 5 walked almost 2 years longer than those who started steroids later. And in group B, the group we'd expect to have the most similar progression, those who started steroids younger walked almost 3 years longer. Next. These results were able to show that for Duchenne patients, steroid treatment prior to the average age of diagnosis meaningfully prolongs walking. And if we control for variants that are expected to have a similar presentation, we find larger differences. Even though we couldn't find siblings with these treatment differences, the variant-specific results allowed us to understand how steroids impact ambulation when prognosis is expected to be similar, which is exactly what the committee was looking for. Next. This data ask from the federal committee reflects similar questions that we get all the time from stakeholders. We've tried to choose survey questions to proactively collect data for questions that could be asked. Having the answers to those questions from participants like you and having the updated answers as time goes on is critical to turning around the research quickly when needed. So I give a huge thank you to all those participants who shared their genetic test result, the ambulation information, added siblings, and all the other data points we used for this project. This was one of the most powerful pieces of statistical evidence and largest data sets presented in the symposium, and that's because of the experiences shared by so many registrants. Next, thank you. We held the Early Intervention Symposium in March of 2025. Between this project and others submitted by researchers and clinicians, the symposium presented strong evidence supporting the inclusion of Duchenne to newborn screening programs. Next. Unfortunately, after over 20 years of reviewing and recommending conditions, the federal committee that votes to recommend conditions to the RUSP was dissolved in April, so we haven't been able to get our vote for Duchenne. However, we still have this very powerful data. We're working on getting the symposium's projects published and are using this and the decade plus of data the community has compiled to advocate for the completion of our evidence review, which can be used for state and federal advocacy moving forward. And so I'd like to thank you again for helping us reach a place where we're comfortable weathering this uncertainty and moving forward with strong data to ensure that all people with Duchenne have the opportunity for early diagnosis and treatment. With that, let me turn it back to Anne and Lauren.
Thank you so much, Catherine. We hope everyone listening is proud of what the registry community was able to accomplish with that effort. It's really remarkable, so thank you. Before we wrap up, we'd like to give a brief snapshot of the vision for the future of the registry. So, next slide. So the registry is one component of PPMD's larger efforts to bring many data sources together for the largest impact. As an example, PPMD has another research protocol that, alongside with the Duchenne Registry, contributes data into a collective data warehouse that we call the interchange. So the effort that I'm referring to is PPMD's EHR study. And the EHR study involves the consent of patients at specific clinics across the United States to permit their clinical data to be submitted directly from their electronic health record on an ongoing basis. And because it's coming directly from the hospital's medical record, this EHR data has additional data elements that are especially beneficial to maximizing the use of this data. We currently have 5 clinic sites who are actively enrolling participants into our EHR study, and we have several more that are preparing to do so. And if you'd like to learn more about the EHR study, please visit the Duchenne Registry website. Next slide. All right, so our goals for the Duchenne Registry itself, we continue to look for innovative ways to grow both the number of participants and long-term participation. Entering registry surveys at multiple time points is critical to solve important research questions that require us to understand the treatments, healthcare, and other factors that can influence health over time. And as Jen mentioned earlier, participation does not have to be perfect. Our other current goals with the registry include adding validated quality of life measures to the registry. And of course, we're always seeking to improve the registry experience for our participants. Next slide.
So for current and future registry participants listening, we hope you will take a few minutes to take the next steps to join the registry or add to your participation in the registry. So this is sort of the choose your adventure of QR codes. If you're considering joining the registry and you'd be a new participant, use the QR code all the way to the left to join the registry. It'll take you to a through link to start that. You can also find a link to the registry at the very top right of PPMD's homepage. If you're currently participating in the registry or you've been enrolled in the past, we hope you'll take a moment to download or open the app from your device. And so there's a QR code for an Apple device or an Android device, like something that would go through Google Play. And we hope you'll take a moment to make sure that app can open on your phone, log in, and complete surveys that you see within your app. Next slide. So before we answer questions, we would like to thank all registry participants, special speakers today, Pat Furlong and Jen Schwartz, my wonderful team, all the PPMD staff, and our amazing registry steering committee. And we'll conclude on a final quote, of course, and then do questions. And this quote comes from Seda, a parent and steering committee member. And she says, the Duchenne Registry has been a way to turn something so difficult into purpose. Knowing that our data might guide clinical trials or help identify trends gives me a sense of agency. I hope more families join. Our shared experiences are powerful tools for change. And with that, I can, in fact, all our panelists can see questions coming into the chat. And so I'm going to help us moderate and feed through this. So one question I saw already, it's a direct question to Jen, if you're still here, Jen. And this question is, has involving been in these pieces, which I think means like registry participation and questions or similar things, has involving Ben in these pieces been challenging for you and him? Do you think these questions feel like they're helpful in being prepared for his future? What's that been like?
Yeah, great question. I would say how I involve Ben over time has changed quite a bit. So when he was younger, I probably didn't involve him as much, or I maybe would tell him what I was doing, but not ask him questions. As he's gotten a little bit older and to understand the changes to his body, and you mentioned, Lauren, that I'm a Connect coordinator group. So for the state of Iowa, as he's gotten to meet other people, he'll have a little bit different awareness of what different ability levels might be. So I'm definitely selecting the questions that I asked him based on kind of where he is from an understanding standpoint. And I also usually ask him questions that I think he can provide me good insight into. Like Pat said, I think parents and families are the best ones to know. But Ben can even give me more description on what's easier or harder for him. So I am selecting where I ask him questions. I don't ask him the technical ones. But sometimes I say things in a little bit more generic way too, like, hey, has it been easier or harder to do this? And then he can give me a little bit of input that helps me answer the question, but maybe not reading the question directly.
And has that been sort of evolving with time? Obviously, you've been participating for many years.
Yes, I would say I probably didn't start asking him questions until the last few years, which he's 12 now, to say, like, hey, I thought of this thing, or it maybe comes up in a different conversation where I was answering the registry and it got me thinking about this. So it definitely has changed over time, and I think it'll continue to change over time. At some point I may hand him my phone and say, here, you can help report through this information because you'll have the best sense for it.
Yep. And I think that reflects what is an ideal process. I mean, the we want people to become active participants and feel the agency in the use of their data. And of course, then there's a transition point that happens where very much so, sometimes it is still mom or a guardian who facilitates use of the app, but we hope that our adult men take over that agency of they are the answers in a formal way for their data over time. So glad to hear about how that experience, that evolving experience has gone. I received a question, or we received a question in the chat about, is the process the same for Spanish-speaking users to access the registry? So grateful for this question. One, because it gives us the chance to point out that the registry is available in both English and Spanish. So the entirety of the use of the app of the registry, every survey, all of that can be completed fully in Spanish. There is one minor difference in the way the registration process starts. So on our QR screen, or from just going to PPMD's homepage and clicking registry, everyone then clicks a join button. And as soon as you click that join button, what you're going to be shown is a few little sentences about what to do to join. There will be a Spanish section that says if you are Spanish speaking and wish to do the Spanish portion of the app, you'll enter an email and say that you want the information for that. And then we will trigger the invitation that will directly take you to the Spanish version of the app. So it still really is the process of clicking join and seeing that there. More so, it's even just like a slight tweak on our end to make sure we're sending you the correct version of the app. And from there on out, your experience should be entirely um, fluid and the same as an English user of the app. So really appreciate that question. How long, ooh, and I see a question, like a follow-up question coming through. I love it. I'm looking at real time. How long does it take to get a response from that? Like, I think referring to the email about Spanish speaking because it was coming in while I was talking. That is a response managed by this team. So that is the me, Catherine, Kayla, and situation. We aim to answer those all day long during business hours. no team is exactly perfect, and sometimes we're all traveling, we're at annual conference or other things, but our goal is to respond to that very quickly, so that next steps are nice and fluid for our Spanish speakers. All right, I'm going to scroll for a moment. Now, one question, as I read through some of the next ones that we've seen, or in general, as an ask to Catherine, heard you about the sibling data. Is it still helpful? The meeting happened. Is there still a benefit to providing some of that data now?
Yes, absolutely. So certainly that data benefits all other future projects, understanding how variants can affect siblings differently, things like that. But even for these advocacy efforts, we expect to be working in the future to answer questions from states and laboratories that are considering adding Duchenne to their newborn screening. So if you think, I will say this too, if you think that you have registered a pair of siblings that meet this criteria that we didn't catch, that's another good opportunity to email us at that coordinator email to check on that account and make sure that those siblings are identified.
Wonderful. A question for Anne briefly. When we say the phrase like sharing data, like outward to partners, what gets shared in that capacity?
Yeah, that's a good question. Well, it's a process that we go through with whether it's a academic researcher or somebody from industry requesting the data, but we review their request and determine, if it's a good use of our data. And then there is an agreement, a data access agreement that both parties have to sign, and that covers things like how they're allowed to use the data and confidentiality of the data, and that we expect them to share results back with us, things like that. But the actual sharing of the data, when we send the data files, we do completely de-identify those. So that means we take away a lot of the personal information that you're entering into the registry. So we're not sharing your name or your child's name. We're not sharing your address. Specifically, we would share like the country you live in, but nothing specific as to your exact location. We don't share your email. We don't even, share complete date of birth. We generally would just share the year that your child's born. So there's kind of a strict protocol we follow for how to de-identify data before it is shared. So we're very careful about that.
Amazing. Now, there's a couple like technical questions that are coming in that I'm hoping maybe my teammates Kayla or Catherine will give us some of that like direct user support, if you're able to chat back, in case we don't get to all of them. Now, one question we got in our chat here was related to um, like trying to understand like who else is out there, what are the connections that can be made. And so I think there's a number of ways to approach this. We always want people to know about our ways just within PPMD to connect. So local connect groups, virtual socials, utilizing our like newsletter and our website for events. We'll have a lot of ways to connect to others. When people have questions about specific variants, I think this is one great use case for using our PPMD for You offer on the website to schedule time to chat with a genetics team member. Anne, Kayla, Catherine, and I are all genetic counselors by training. That's partially why we do the curation of the genetic test reports. When we indicated there were, how we look through publications and look for variants. I think if there are always like very targeted questions, that is a great time to schedule a time to chat with someone and see what kinds of information connections can be made. And I want to address another question that kind of just recapturing like how how does this help? And if we were going to sum up and kind of frame for the end of our webinar, like how is the registry designed to help families? One thing we will be candid about is that the registry is research. And so, as is many research studies, um, there is not an assumed or universal personal benefit to participating in the research. But the hope is that collectively, the power of all of us, from the individual data points to the full size of data points, has this full circle ability to enhance our knowledge, drive care, and that as a community, we receive those benefits forward. And I appreciate that question because we know that the registry requires your time and energy, and we're hopeful for um, it, you know, your willingness and grounding in that why to give of that. Um, the last little thing is more so like when you have some questions, right? Even some of the questions that are coming in late that I'll stay on and answer. But even those, as you think of questions, you're watching this a different time, absolutely just email us. So if you're on the Duchenne Registry website, it will list this email at the bottom. Um, Emily, I don't know if you even want to bring up that slide that had the coordinator email address on it. Like I'm all about screenshotting something on my screen that I'm looking at, but we are coordinator at parentprojectmd.org. So again, if you're on the Duchenne Registry webpage at the bottom, it's going to say who you can contact. Feel free to reach out with these questions. How's this happening? How's this working? That is the goal of this moment we're taking, is to build these connections to you. Now, I still see some other questions, and I intend to stay and answer them. And so, for those of you who with a hard stop at the hour, we're so grateful you were here. I'll stay for a couple more moments and tackle these. And if you're able to stay, wonderful. For example, we received a question about, is it too late at any point to add someone to the registry, someone who's maybe already a teenager or they're already an adult? It is never too late. It is truly never too late for a number of reasons. Although some of the questions are very much framed in the what is happening right now in this moment, there are also many questions in the registry that capture part of your history. At what age were you diagnosed? That probably already happened before you joined the registry. We'd expect it to. What age did you lose ambulation? When did you part-time start needing some sort of device or scooter? When were you started on, at what age were you started on a heart medicine or a steroid? Have you ever received a gene therapy? And so all of that capture, even if we're starting that information, um, you know, many years after diagnosis, wonderful. It is wonderful to have that. And our reality is we want the registry to capture the full population that also includes individuals with Becker, women who are carriers, or if there are like daughters who are carriers that we know about them being in the registry. The reality is, especially for adult women, we're learning frequently that, that they could be carriers as an adult. And so there's no wrong time to start, and any of those pieces of data matter. I'm really glad for that question. I also see a question about whether there is a browser option for the registry. Basically, like, do you have to use a device? Can I use it on like a web, like a screen or a computer, or just a website? So this is when Anne was mentioning our goals for ease of use. I would say this is very top of the list. It has been on the radar for many years to make sure we can reintroduce a web version of the app. I wish we had an exact firm date. This is being recorded in May of 2025, but this is a top priority that we expect is very shortly on the horizon for us to be able to deliver. And you best believe that there will be emails that come out that will announce when that is available. We know that this is important. We have especially heard this from our adult men, that this is highly important to their ability to use the registry. And so I want to acknowledge that we know that this matters and that we intend to deliver this. I also see a question about how can extended family help with or use the registry? And there's kind of two ways to think about it. Number one, there's not a requirement for exactly who has to register for a child, for example. Now, that does need to be the person that is able to consent for them. That's why we use guardian. But sometimes the guardian is a person's grandparent, Or sometimes it is essentially a team of people, right? Like mom signs the consent, but mom and dad are both supporting this, or mom and grandma or some other person is helping facilitate sort of some of the long-term data entry. And so it's open-ended in terms of course, beyond needing the appropriate consent, making sure you've got the team in place to help with data as you like. I think the other thing, Catherine talked a lot about siblings. Um, Really, there are all kinds of family members who may share the same variant for whom that is also of strong interest is to understand the entire picture of a family when possible. So in a family, sometimes it truly is only one person with the variant, but sometimes it's multiple siblings, both boys and girls. It is mom and mom's sisters and the original children's cousins or grandparents. And so I think one way that extended family can support the registry is just to join. If you know your variant status, um, please consider participating in the registry. It is truly intended to cover anyone with a variant. So, especially for people who may have a later onset Becker or who are carriers, you do not have to be at a certain state of symptoms or to have symptoms to participate. Part of the design of the registry is to capture who's experiencing what, who's not experiencing certain things, so we can better understand the community. And I think our last question is tactical. And again, if you have tactical questions, we would love to hear from you at this email. When you register, the idea is to register the participant. So if you're entering for your child, the child. However, as soon as you start your registry surveys, we always say start with your About Me survey because it's going to tell us things like who's actually the caregiver who is entering these responses. And you'll be able to signify your name, the way you want to be contacted, and all of that good information. Um, Now, I see, thank you to everyone who has been chatting. Thank you to everyone who has been listening. We look forward, thank you for those who are listening live, but we look forward to other viewers who will see this in the future. Please feel free to contact us if you have registry questions, and we hope you have a wonderful day.